For now, they have their room for error and an opportunity to correct it. This is a part of their learning, and they work with a life-size mannequin instead of a patient. Everything else they use, a resuscitation ambulance and its equipment, imitates real practice. Zaporizhzhia State Medical and Pharmaceutical University has been practicing medical simulation for more than 10 years. Primum non nocere. This Latin saying means do no harm. Since the time of Hippocrates, this is the grounding principle of medicine. In the 21st century, the technological development actualizes medical simulation, which involves case modeling and mastering practical skills at the preclinical stage with the help of mannequins. How do we train future doctors according to modern standards? Students begin learning human anatomy in the Anatomical Museum using 3D technologies. Professors deliver lectures of anatomy using anatomic table Anatomage. The combination of the unique hard and software enables not only to learn real-size human anatomy, but also to study a library of cases with rare and clinically authentic data of real patients. Our learning process involves the use of boundless opportunities that VR technologies grant. This equipment enables to examine the most remote parts of the human organism, learn separate anatomic structures, work with 3D images of the inner organs, and learn them up to the cellular level. This equipment is used by the world-leading medical schools. The university hosts several modern training centers. Their total area is 3,300 square meters, which meets European standards for medical universities. One of them is Interdepartmental Training Center. It comprises separate divisions for dentistry, physical and occupational therapy, cosmetology, and laboratory diagnostics. There is also a learning virtual chemist shop. We have recently created a new medical learning and scientific center. Our university is proud of its unique equipment. Here, future doctors can take their interesting and complicated career path, from obtaining theoretical knowledge to mastering professional skills. All equipment is as close to real as possible. It includes blood sampling, intramuscular and intravenous injections, vein catheterization and transfusion. There are simulators for practicing emergency care skills. The educational process involves maximum visibility for each student and intern. It is also important that during training the students acquire skills of teamwork. The learning process is easy and relaxed, stress-free for students and harmless for patients. The training center comprises several departments. Each of them resembles a hospital ward. In the intensive care unit, basic and advanced algorithms for providing emergency care are drilled. The equipment allows for blood pressure measurement, virtual monitoring of the patient's vital functions, ECG recording, defibrillation, and cardiopulmonary resuscitation. During training, students have the opportunity to bring a simulated patient back to life as many times as necessary to master the relevant skills perfectly without risking the patient. The obstetrics and gynecology division is equipped as a real delivery room. Noel, a mannequin of a woman in labor, and a childbirth simulator make it possible to recreate both the physiological and pathological course of events. The neonatology unit next door has realistic conditions for multidisciplinary training. The pediatrics unit has mannequins of children of different ages, from infants to teenagers, designed to practice different methods of examination and simulation of emergency conditions. The hospital unit has highly realistic robotic mannequins. They can make complaints, breathe and cough. They can be used to define skin cyanosis, determine the direction of the pupils to light, auscultate the heart, lungs and abdomen, determine the pulse in the central and peripheral vessels, measure blood pressure, record an ECG, and provide emergency care. The Functional Diagnostics Unit is equipped with real medical devices: ultrasound scanners, electroencephalograph, pyrograph, electrocardiographs, and daily ECG and blood pressure monitors. Here, undergraduate students can work not only with mannequins, but also with real patients using real medical equipment. The center has a unit of emergency medicine, where you can practice actions in emergency situation. For example, helping in the event of a road accident. All necessary equipment for stopping bleeding, immobilizing limbs, and transporting the injured is right here. Mannequins with burns, gunshot wounds, and mine-explosive injuries allow students to practice the skills of helping at all stages of evacuation. Future surgeons master the secrets of their profession in the new Educational, Medical and Scientific Multidisciplinary Training Center. It has not only simulators that allow you to master the basics of laparotomic surgery, such as suturing tissues and blood vessels and making knots. There is a super modern operating room with a laparoscopic tower. Various laparoscopic and laparotomic surgical interventions can be performed and simulated on the CLO S2101 high-tech female surgical mannequin. This simulator allows you to imitate numerous conditions that occur in medical practice, such as termination of ectopic pregnancy, various neoplasms in the abdominal cavity, and other types of complications. The mannequin is compatible with real equipment and real surgical instruments, which gives learners the opportunity of complete immersion in the realities of the future profession and sharpening skills to automatism. Recently, a fully equipped family doctor office was opened in the center. It has unique appliances for telemedical consultations with medical specialists. The portable telemedical diagnostic complex is designed for telemetric measurement of patients' vital signs, digitizing the obtained data and transmission over the internet for telemedical consultation. The complex includes a digital video camera for examination, a tablet, a visual signs monitor with a digital interface, a digital video dermatoscope, a 12-channel electrocardiograph, a glucometer, a cholecystometer, and a spirometer. Owing to the electronic stethoscope, you can create a recording of heart and lung sounds and listen to it during the examination. After completing all the procedures, the program saves the obtained results both in the device and cloud storage. In case of a long examination, the program saves the data automatically so that no clinical protocol is lost. Future dentists are trained using the most up-to-date technologies. On these mannequins, they learn how to properly perform an examination of the oral cavity, practice the anesthesia of the upper and lower jaw, tooth extraction, and other manipulations. This high-tech simulation center is equipped with visual jaw models, modern dental devices, and learning articulators with jaws and interchangeable sets of teeth. Here, future dentists master their work, learn to operate various stomatological devices, and use dental materials. Cameras enable two-way communication between teachers and students, so the manipulations are thoroughly controlled. Students learn the principles of pharmacist work in various situations, including emergencies in learning and visual pharmacies. The first one is no different from an ordinary chemist's shop. The second one immerses you in hundreds of realistic scenarios. The technology involves a dialogue system and has a variety of case studies, including a trading pharmacy and a hospital pharmacy. As requested by our university, the manufacturer added the functionality of editing existing and creating own scenarios adapted to domestic realities. The program is easily installed on any gadget and allows you to learn at any convenient time. There is also a separate training center for those who master physical therapy. It hosts dozens of interesting locations, robotic simulators, and mannequins. Everything here is designed to obtain the skills of rehabilitation of patients with various health problems. The Training Center for Future Cosmetologists can boast the most modern equipment and mannequins for learning the latest methods of diagnostic, treatment, and prevention. Only after getting all the basic knowledge, future specialists are ready to face real patients. Before that, they can only use medical simulation. The Patient Simulator Body Interact provides a variety of scenarios from the clinical aspects of internal diseases, pediatrics, surgery, obstetrics, and emergency conditions. The device is so realistic that it allows you to communicate with a virtual patient and monitor the state of its health depending on the treatment tactics. One click on a panel, and you can choose the necessary examinations, perform laboratory and instrumental tests, establish a diagnosis, and prescribe treatment. Choose a drug dosage taking into account the body weight, height, and weight of the patient. The clinical condition of the virtual patient changes depending on the care provided. Therefore, students can check the strategies they use and analyze it for the future. More than 1,000 students can simultaneously use the program for studies or exam taking. You can access it from various gadgets, laptops, tablets, and smartphones, as well as from different geographic locations. The evaluation of future doctors is performed with the help of simulation equipment in the OSCE Center. At each station, students cope with various practical tasks that have been previously practiced. Teachers can fully control and evaluate the knowledge and skills acquired during training. Interesting and exciting learning. No stress and irreparable mistakes. Comfortable and friendly atmosphere. Modern technologies. Zaporizhzhia State Medical and Pharmaceutical University. Quality education of the 21st century.